Doctors of Reddit, what's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you like it's a group project? Do you not go at all because you're your own doctor?
Doctor here, it is a bit dependent on the field of medicine involved. For example, I don't know much about neurological issues, so if I went to see a neurologist I certainly wouldn't be chipping in. For more generic conditions I have previously offered my thoughts to my doctor about what it could be. Ultimately I still go to the doctor as they can prescribe drugs/order tests for me that would be difficult/questionable for me to do myself.
Doctor here, family medicine? I self-diagnose most things, but for my 1-year-old daughter I decided a while ago that I don't want to do that for her. So her pediatrician doesn't know I'm a doctor, I never told her. I want her to treat me like any other parent, and explain everything to me like I'm 5 years old. I'm afraid of being too nonchalant with my daughter's health that I'll miss something, or the doctor assuming I know more than I really do. It's actually a strategy I've adopted since on myself. If I go to a doctor, say a gynecologist for a routine checkup, I sometimes just don't say what I do so I can legitimately ask dumb questions about things that I should really know, or so that the other doctor won't leave out important info that they assume I know for fear of insulting me. On the other hand, my regular doctors do know, such as the gynecologist who saw me through my pregnancies, and that enables more complex and nuanced discussions about health decisions and debating questions, and giving me options that he wouldn't necessarily do with itty patients. BC he can be sure I understand the medical pros and cons well once I'm given a basic explanation.
Doctor here, neurologist. I'm not good at going to the doctor. I don't go often, but when I do I usually just STFU, especially if it's a field of medicine I have no idea about, like say derm. That being said, the doctor usually knows I'm a physician as well, and so the language terms to be more technical. I also find that we practice less defensively with each other since we can be more open. We could do ABC tests, but honestly what you probably have is X, so take this, and if it doesn't get better then we can do ABC.
I was sat in a consultation between two doctors with one needing an ultrasound. They knew each other through work already, so it was very friendly and casual between the both of them. The patient doctor trying to figure out what was going on the ultrasound screen, and the doctor was teaching him the bits he didn't know.
My mom's a GP and she usually just self-diagnoses most of the time, but will sometimes get a second opinion. She doesn't really go to another doctor, just calls them to ask about stuff. Her contacts are filled with all kinds of doctors. It's like a secret underground community. For stuff like getting ultrasounds etc., then yes, they do discuss stuff like it's a group projectist.
I'm an doctor, and sometimes I have other doctors as patients. For the most part they're pretty good patients because they can give a good description of their symptoms in a way that's useful to me. They usually ask good questions and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk where I simplify medical terms for laypeople. Sometimes it's challenging if their area of expertise is totally unrelated to the issue at hand and they don't recognize their limited understanding. The worst patients are those who have just a little medical knowledge and think they know everything. Some version of, my aunt is a nurse, and she said I need a whole body MRI for this runny nose. As far as self-diagnosing, I usually deal with my own minor medical issues. If I noticed signs of something more serious, I would go to someone else.
It depends on what I'm going in for. As a background, I'm an oncologist, so I've trained in internal medicine before. For most internal medicine type stuff, I don't bother going in unless I need something that I can't easily get for myself, for example labs or images. For specialty stuff I wasn't trained in, I go in and try to give them the best history I can, but let them do their own thing.
Doctor here. In general, we are not good about going to the doctor. For me it's physicals about half as often as recommended, and that time I had strep a year and a half ago that didn't resolve with whatever antibiotics I had in my medicine cabinet. When we do go in, it is like a group project. We usually hash things out together, but ultimately I am going to defer to someone with more expertise than me in that area who can make an objective decision.
I don't get involved in the management. I let the doctor seeing me lead that, unless they miss something huge, and I would just double check. The main difference is I can present the whole history and relevant info in about 30 seconds flat, and the doctor with that info can just give me the management plan in about the same time. Fastest consultations ever. Very methodical.
I hope you get some doctors in here to give personal answers. Paul Kalanithi did address this a bit in his book When Breath Becomes Air. At first in his cancer treatment he was very involved in the decision-making, and the way he described the conversation with his oncologist was more like a collaboration. Later, she reminded him that he didn't have to participate in the decision-making and that he could just let her be the doctor and focus on himself. He ended up taking her up on this offer. So even between the same patient and doctor, the relationship varied.
Both my parents are doctors, and they see each other as their doctors. For their situation, they don't make appointments for anything, so if I or they get like the flu they just write a prescription. If they need specialists, they usually tell them they are doctors and they get better treatment like skipping lines or whatever, or they know each other already so it's chill. I'm sorry this kinda sounds spoiled, but it's my experience.
My mom is a nurse and never tells the doctors what she does for a living. It's so they'll speak to her not as a nurse but as a patient. Even though she can understand what they're saying when they use their medical jargon, she doesn't want them to be overly comfortable using the jargon while treating her.
Always heard doctors are the worst patients.
Obligatory, not a doctor, but spouse of a doctor. I thought I might have a ganglion cyst in my wrist because I could feel something inside that was causing pain when I moved my wrist, so I scheduled an APPT with an orthopedic surgeon, hand specialist. I had my husband come along, interventional radiologist, in case there were questions I wouldn't have thought of asking or something I needed more explanation on later. The ortho, hand surgeon was friendly and used layman terms with me but technical jargon with my husband. It was funny to hear the switch between your wrist bones, tendons and blah blah anterior blah blah medial blah whatever he said to my husband. At one point they did an ultrasound on my wrist to determine if it might be a cyst or if I should get a more detailed MRI, and the surgeon asked my husband if he wanted to take over the ultrasound, since my husband trained in diagnostic radiology as well, and he totally did. Weird to have your husband moving the ultrasound wand and pointing to random blobs of static. They both agreed it was a cyst, even though it looked like a whole lot of static and nothingness to me. So it was interesting to see my husband defer to the surgeon for his specialty and vice versa. Edit, just remembered that time we took our cat in for an X-ray because she was developing arthritis and we weren't sure how severe it was or if her bones were deteriorating. My husband actually took her X-ray in and had an attending in radiology read it, and they were both convinced our cat had bone spurs or little bone growths around her spine near her hip. He was about 80% convinced that our cat's spine was absolutely wrecked. The vet wasn't worried and said that cat bones just look like that and it wasn't hurting her and was nothing to worry about. He ended up doing some research on feline anatomy to make sure our very knowledgeable vet wasn't just talking out of her ass. She wasn't. Anyway, moral of the story is that he went to med school to study human anatomy. Not feline anatomy, so he had to learn to take a step back and defer to the expert.
My grandpa was a cardiologist, and he's the worst at knowing when to go to the doctor. As he got older he would get cardiac arrhythmia but keeps saying that everything is fine and he doesn't need to get checked.
I always go to someone who don't know me, and I wouldn't say that I am a doctor as well. On the other hand, my so is a doctor too, and whenever we feel something we do discuss it like a group project, in which he always refused any treatment until his symptoms got to the very worst.
This a good ass question I would like to know as well.
May your day be filled with joy and happiness. And please remember to like, share, and subscribe for more quality content every day.